Welcome to today's webinar. The topic for this event is a DS Smart demonstration. My name is Savannah Romans and I will facilitate today's meeting. The information contained in this presentation is intended to provide general information, but not advice about certain regulations and initiatives. This is not intended as legal or other advice, and each situation may vary depending on the particular facts and circumstances. You should ensure compliance with your unique building, locality, and licensing considerations, and consult with your compliance and legal teams. Today's webinar will be presented by Renae Buyeske, our Technology Solutions Program Specialist. Renae provides product expertise, overviews, sales training, and demonstrations for customers and internal sales teams for Direct Supply's Technology Solutions platforms and connected clinical platform DS Smart. Now, please welcome Renae.
Wonderful. Thank you, Savannah. Welcome, everyone. Really appreciate everyone taking the time to join us today and taking time out of your busy days to learn a little bit more about DS Smart. DS Smart is Direct Supply's app-based platform to help you connect clinical data from your clinical pieces of equipment directly into your electronic medical record. I look forward to talking through with you today and showing you what the system's capabilities are and following up with anyone that is interested in more information after our demonstration today. We started this journey with DS Smart and building out this platform a couple years ago. And that journey began from voice of customer and concerns from everyone, every one of you, the voice of customer, coming to Direct Supply and saying, here are the challenges that we're facing, and here are the challenges that the industry is seeing. How can we make this better? And how can we help deliver better clinical care, not only for our staff, but also for our residents? Now more than ever, there's more choices for employment. There's nursing shortage, low unemployment, high turnover, lots of things that many buildings experience, as it relates to challenges that we see at the building. And DS Smart was really based and built off of the platform to say, how do we give you the capability to make the most of the nursing time that you have in your building? And how do we give you the capability to take more time away from vital documentation and put that time back into your building and back into your residence where care matters the most? Now, more than ever, with COVID-19 at our doorsteps, of course, we're seeing increased number of vital rounds that need to be taken to monitor the health and ongoing and continuing health of our residents, and hospital and physician relationships needing more communication remotely now more than ever, and data that is needed to be captured real time in order to make the right decisions and right choices that we need for the care for our residents during these tough times. All of these things really contribute to how DS Smart was created and how we continue to adapt and change the platform as needed to accommodate for some of those ever-changing needs. We have four main benefits as it relates to EMR connectivity and connecting your information directly to the electronic medical record. First and foremost, with all of those challenges that we face in front of us that we just spoke through, time savings. Being able to take that time and put it back into our caregivers' day to do things other than sit behind a computer or stand at a kiosk and read over paper and read over manual documentation, typing that information in. Being able to grab that time, put that back in the day to do other things and be able to provide different care that we need to for our residents. On average, from manual documentation to using DS Smart, time savings that we see is about 40%. What that equates and boils down to is about 1 minute per vital taken per resident. So if that helps, high level, to give you a little bit of an idea how you could easily, scale that out to what does that mean for your buildings? 1 minute per vital taken per resident every single time you need to go through and take those rounds. And then take those minutes, add them up, and that's the amount of time per day that those caregivers can get back in their day just from eliminating that manual documentation. Secondly, the accuracy of that data is coming directly from the equipment itself. So for example, we use a vital sign monitor to capture blood pressure. I grab that blood pressure and it's automatically in my EMR. The number is coming directly from the equipment itself with no interpretation in between. No natural human error of accidentally writing it down wrong or then accidentally typing it into the computer wrong. In addition to that, we get that data for what we call real time. So meaning that within seconds, we grab the information from the vitals equipment and it's dropped into permanent record underneath that resident's specific name. During COVID-19, we see that that's more important now than ever because physicians, are asking for real-time data and being able to grab that information and say what really truly was the reading in the morning when we went through and took those vitals, afternoon, mid-afternoon, so on and so forth. And we are able to grab and drop that information in, and they can see as the day is progressing how those vitals are benchmarking and comparing to each other to monitor that health remotely by being able to just simply log in the EMR and see that information in there. Both of those things together, the increased time savings and the increased accuracy of the actual clinical data, will lead to better and improved clinical outcomes, giving you more time to do different activities and things with the residents, getting that information real time for physicians to make real time decisions based off of care that's needing to be implemented, can all help and provide some of those improved clinical outcomes. Last but certainly not least, as you'll see when we go through our video in a little bit here, DS Smart is very easy to implement and support. Now, the last thing that buildings need is another thing to manage, another thing to worry about, and another thing to get set up and started in the building. Rest assured that in under 5 minutes, everything can be connected, sending data, and staff trained to be able to confidently go out on the floor, do their rounds, and get the efficiencies and benefits of using DS Smart and connecting that clinical data directly to your electronic medical record. So let's jump into how does DS Smart work. The slide that I show here, I'm going to walk you through in three portions and three pieces. I like to kind of break it out into 3 portions to give you an idea of all these buckets and all these portions. Once we have all 3 fulfilled, gives you the full working DS Smart solution. So starting from the left, you can see that we have a direct supply attendant connected vital sign monitor. This is an example of a piece of connected equipment that works with our DS Smart system. So bucket number 1 would be, what is the clinical equipment that you're looking to actually connect to DS Smart? In this case, the vital sign monitor. So we would be purchasing and investing in the equipment that we need to do that connectability. The device itself in this instance and that rolling stand. This device is Bluetooth enabled, and Bluetooth is the main communication that we use to communicate with DS Smart. All of the equipment that is enabled to send vital information into DS Smart is Bluetooth enabled in order to ensure that if you lose Wi-Fi or don't have strong Wi-Fi in your buildings, we can still move forward with that general workflow, do our rounds, and capture that data into bucket number 2, which we see in the middle here. Like we said in the beginning, DS Smart is an app-based platform. That app that is downloaded on a tablet that you see in the picture here and allows us to run the platform and grab that information from the vitals equipment. What's associated with this bucket is 1, a tablet, so to be able to run that app-based solution and see the platform working on that tablet and going through and doing your rounds. In addition, we also see that this tablet is mounted directly to the vital sign monitor itself. This mounting solution is optional, but gives you the capability to permanently and securely lock that tablet in place and permanently keep it with the vital sign monitor for the benefit of having everything all in one. I grab my vital sign monitor from the nurse's station, and as I go down the hall, I have everything that I need in order to grab, capture, and send that data into the EMR. That sending the messaging of the information from DS Smart into the electronic medical record is done via Wi-Fi. So our third bucket is our wonderful electronic medical record partners. We partner with Point Click Care, NetSmart, and Matrix Care. Anyone who has those electronic medical records, we are able to communicate and automatically send that data directly into that system from DS Smart. So that would be bucket number 3, working with the EMR partner that you have out of those 3, and the fees that are associated with getting that communication up and running and getting that communication to stay live to have your data flow back and forth. So bucket number 1, our equipment that we're choosing. Bucket number 2, tablets and mounts in order to secure and run that platform. And then bucket number 3, an EMR that we work and are compatible with in order to get that data to go to permanent record. With that being said, I am going to jump into a video here and give you guys an example, run through a video here to give you an idea of what does that platform look like. So when I actually run DS Smart and I pull that up on my computer here, we'll give you an idea of logging all the way from logging into sending that vitals information, what that looks like. In this example here, we're going to go ahead and show you what the platform looks like for capturing vitals data. So we'll go ahead and play that here. All right. So first and foremost, on the tablet here, you'll see our home screen. So this home screen would be loaded on your tablet once you have that tablet mounted in onto the vital sign monitor. This is your login screen and the way that we go ahead and launch and get into the actual DS Smart system. So from this screen here, I would simply type log in, and this will take me to my first login screen here. The login credentials match the login credentials that you use for your electronic medical record. So any of the credentialing, usernames and passwords, PIN codes, anything that is currently set up to get into your actual EMR that your nurses today use to log in would be exactly the same that you use to log into DS Smart. The benefit being we don't have to remember extra usernames and passwords, and logging in with those credentials gives us the capability to do no management in the actual DS Smart system. All of your management is done in your electronic medical record. So residents, additions, resident discharges, credentialing, what nurse is in charge of what residents, so on and so forth. All of that information will pull real time into the actual tablet itself here. This next screen will show you an example of what that looks like. So this is us logging in, and then a resident list automatically being uploaded and pulled from the EMR real time into the actual tablet here. So it gives us the capability to scroll and select a resident that we're going to go ahead and take the information on. This next step here is selecting what Bluetooth device we want to go ahead and connect to. There are multiple pieces that we can choose from, and in this instance, we're going to go ahead and select a vital sign monitor. I would use the vital sign monitor how I normally would during policy and procedure, take the vital information that I need from the residents, and once I have those on the vital sign monitor, I would hit get readings. Via Bluetooth, it will pull that information automatically from the actual VSM. In addition, we added a respiration feature to the DS Smart app. This allows you to manually count and type in respirations to add that additional vital information to send a permanent record. This screen here then will give you the opportunity to review the readings that you've pulled in and make any adjustments and changes that you need to. So deselecting blood pressure if you do not want it to go, or refreshing any of the readings that we either need to pull new readings in or refresh and get new numbers pulled into the actual screen itself. So once we have everything that we have satisfied and everything in white will go to permanent record, what I do is simply hit send to chart, ask for additional documentation that the EMR is requesting, and hit a final confirm and send. Once we get green check marks in the boxes, that means that the information is in permanent record in the EMR underneath this particular resident's name, and the readings will go ahead and clear from the actual DS Smart system. DS Smart does not hold any data. It does not allow us to go back and look what previous readings were or any history and data of the resident itself. So for HIPAA reasons, very secure and very locked down. All that information, now that it is dropped and held, will be in the EMR, and they would access that EMR data as they need to for some of that history and longstanding data. DS Smart does have the capability to do threshold warnings and pull that information from the actual EMR itself. So for example, if we have a threshold set on, let's take SpO2, for example, pulse oximetry, this will give you the capability to display real time if for some reason the information that we send into the EMR has exceeded that threshold to alert us real time and the nurse that is right there next to the resident what's going on with some of those readings. If I'm done with this particular resident, I can hit the back button. It would take me back to the resident screen, and I could continue on with my additional residents that I need to take vitals on, or I can go all the way back and log out if the caregiver is finished for the day and for that round. That is one example of, in general, how DS Smart works. And again, you could see it all the way from logging in to actually seeing and getting those green check marks, meaning that information is in permanent record. Very fast and very simple user interface to grab that data, verify that data, and then with the touch of one button, send to chart and have that data go into permanent record. On the right-hand side here, we do have a video for scales. Same process in regards to logging in, and you can see that the interface as far as how it's grabbing the data is just a little bit different. It will pull in total weight from the connectable scale that you have, gives us the opportunity to manually type in what is that chair weight, and net weight, which is in blue on the bottom, is what would go to permanent record once we go ahead and hit that send to chart. Videos are available on dssmart.net if anyone is interested in reviewing the vital sign monitor video again or getting a deeper dive into the specific capabilities of the scales. So looking through the ecosystem that we already have connected to DS Smart, on the left-hand side, it'll show you the connectable and capable equipment and partners that we work with to be able to grab data and drop and run that through DS Smart to go to permanent record. We are happy to say that we have partnered with some of the largest national account suppliers that we have out there, both in vital sign monitor equipment and scales. So you do not have to own, purchase, or have already used proprietary brand equipment from direct supply. If you have other equipment, such as the Welch Allyn vital sign monitor or a Detecto scale, all of those have the capability to go ahead and communicate to DS Smart and communicate to permanent record. Like we had mentioned a couple slides before, the two capabilities that we have are the vital sign monitors and scales. And you can see from the scale standpoint, we have a variety from dual ramp wheelchair scales to some wall mounted scales from Detecto, chair scales. So quite a variety for the community to pick from to best suit the needs of the residents that you're serving. From a tablet perspective, DS Smart functions off of two systems, Android and iOS. Direct Supply can sell and provide you the Android system if buildings are needing a solution for that. We also communicate with iOS. So if a community is using tablet technology already in the building, DS Smart can simply be downloaded from the App Store using iOS 12 or higher, and then run on the existing tablets and that investment that you've already made for the community. So lots of options as it relates to the tablet technology running DS Smart. In the future, we really want DS Smart to be a platform system that allows you to accommodate for the ever-changing needs that your community is going to face. And on the right-hand side, it gives you a great example of some of those future products that we are looking to bring into that ecosystem to be able to allow you to continue to build out and really get a good investment on the community's money that they're spending investing in DS Smart. Some examples of the equipment that's on our roadmap are bladder scanners, glucometers, and standalone thermometers. So some of those standalone pieces to add to your baskets and things for your vital solution. We look forward to continuously getting feedback, and we look forward to continuously learning from yourselves in long-term care and servicing those residents to continue to help us to build out that platform and help us understand what is the next best thing, for us to connect and communicate data through that will help you be beneficial in your jobs and serving the residents of long-term care. From an ROI standpoint, high level here, we give you an idea of an average of what that looks like. We encourage you to go to dssmart.net. We do have a calculator out there that'll allow you to play around with some of the data in here to give you an idea of what does this investment look like for my building and what's some of the ROI that I can see. On average, looking at 10 locations, 100 residents, or 3 rounds a day, a lot of it equates down to that time savings that we had talked about at the beginning. So 1 minute per vital taken, per round taken, and how does that look like as we scale it out through the year? On average, my favorite to look on here is how many 8-hour days do we get back? So how many days do I get back for these various caregivers, that are doing this every single day? And it's a pretty powerful number to see how many equivalent full-time, employees all of that equates to. So imagine, the additional work that existing staff could do, to get the time of, in this example, 9 full-time employees to continue to do that care, do other activities, and do other things that are needed at the building, aside from just taking and documenting vitals. Direct Supply can be implemented in your building for an ongoing fee of $199 per month. That's per month per building. And that would be, again, your ongoing fee for connecting. We would love to speak with anyone that is interested to give you a full picture of what that investment looks like based off of existing equipment that you may already own or equipment purchases that you're looking to add to your building as it relates to using the system. In addition, Direct Supply is really dedicated to ensuring that you are successful with this platform. And the way that we could best do that is we added a role dedicated to the customer success of helping your communities not only roll out, but use DS Smart ongoing. We have a customer success manager that can help your community in three main ways. First and foremost, implementation. So like we had talked about earlier, we do not want DS Smart to be another thing that you have to manage, another thing on your plates, or another thing for nurses, to feel like it's an additional task in their day. It is meant to be quick and easy and efficient in order to take that time and really save you the time in your day. Implementation can be as easy as helping you track your equipment and letting you know when it'll arrive, to being successful with putting everything together and any questions that arise in that, and helping you get the connection and the communication for your EMR open and going. So requesting that access and making sure everything flows and is good to go for that part. So implementing, getting your equipment there, and getting your staff up and running. That also includes free training. We have training through our learning management system that can be loaded right to the actual tablet itself. So training on board all the time for any of those nurses that need a refresher or anyone new that might be coming to the community and jumping in to do rounds for your residents. 90% of CNAs we have trained in 5 minutes or less. So again, something really quick and simple that they can learn very easily and get back on the floor and do what they need to do in order to grab that information and do the job for the day. Secondly, understanding your utilization. So we do not want this to be something that gets sent to the building and then sits around and collects dust or ends up in a closet. We really help the buildings understand and track what is that general utilization and use of the actual machine itself. This can be anything from an individual module, so in general, how much are temperature readings being taken and sent, all the way to the entire use of the platform as a whole. This customer success manager role is dedicated to watching that utilization and reaching out to the buildings if they notice some drops or dips in that actual readings, to understand and proactively be able to reach out to the buildings and help. So for example, if we saw a dip in saying, they were sending 50 temperature readings a day, and then all of a sudden we see 10, they might reach out and say, how are things? How are you going? Is something wrong with your temperature module? Do you need replacements or more probe covers? Or whatever it may be that perhaps the community has just lost sight of in their busy day. So to be able to keep that platform up and running and keep that equipment up and running to get the most out of your system. Last but certainly not least, support for your team. So that's both upfront and ongoing. There is a support and help button right on board of your DS Smart app. So at any time, please call us, our dedicated customer service team, to answer any questions that you have with any issues that's going on with your system. If it's after hours, we do have a 24/7 customer support line. So at any time of the day or night, we are here to support you and make sure that your system is successful, up and running smoothly for the caregivers in your building. At this point, I will take any questions that anyone has.
Thanks, Renae, for that great presentation. We do have time for a few questions. What has been some feedback from current users?
Yeah, great question. Thus far, all of our users have been very satisfied with the solution itself. The biggest pieces of feedback that we get is reassurance that training is quick and simple, and the platform itself is very easy to use. And the second one is just the feedback saying how great it is to have the information, again, in the vitals record real time. Within seconds, they were able to actually see that drop into permanent record. And sometimes it's, I can't believe it until I see it. And then they actually hit the send button, and it actually shows up in their EMR. And that's been a really great piece of feedback to hear, that they've been really happy with that solution.
Awesome. What are some of the upcoming integrations and improvements coming from DS Smart?
Yep, so the slide that we had shared a couple back gave you an idea of kind of what that roadmap looked like for what does some of that future equipment look like. Glucometer, bladder scanner, and standalone thermometry are probably the three in our nearest roadmap. So if I'm thinking through 2020, early 2021. We are always looking for feedback from voice of customer and from you in the field, that's really experiencing these things day in and day out, to help us guide what that roadmap looks like. We are not set to a particular way of how we think it would be. Those are some ideas of equipment that we see. So please provide feedback and please let us know, what you would see as beneficial. And we're always looking to change and adjust that roadmap to accommodate you and your buildings.
Awesome. How long does it take to get into my building?
On average, we see about a 2-week turnaround time. So when we think of, I ordered the equipment for it to ship, get assembled, get the activations and everything going between your building and your EMR partner, usually our turnaround time is about 2 weeks. So you could expect to see that in that time frame. From a fees perspective, we do not charge the monthly fee month one. So it does give you the opportunity to do that ordering and training and get comfortable with using the system before you're actually charged an investment to use it.
Great. How does training my staff work?
Yeah, so we have training videos and modules through our learning management system. Those can be accessed both online and via the app itself. So on the tablets, again, an onboard ongoing solution for some of that ongoing training. Those apps are wonderful. It gives you a breakdown of 2 videos, one a little bit longer that goes significantly deeper dive, really meant for a train the trainer or maybe a super user in the building, one person, one role that would do that. And then we have that 5-minute, like we had said, training in 5 minutes or less for the actual caregivers that are going to take it out on the floor. So a 90-second video and some overviews of, in general, how do I log in? How do I grab the information from the vital sign monitor? Very similar to the video that we had showed you today. Send us any emails that you want signed up for that. There's no capacity and no additional money for training itself or accessing that training site.
Very cool. How do I know if I have equipment that will connect in my building?
That is a great question. Direct Supply has the capability to run and grab that data for you. If you're ever unsure, please reach out to your account manager. Tell them that you're interested in DS Smart or you're interested in learning what you have, or if you have something that connects. Reminder that the brands that we connect to is the Welch Allen Connex Spot Monitor. So there's Connex Spot Vital Sign Monitor, our Direct Supply Attendant Vital Sign Monitor, our Direct Supply Attendant Scales, and Detecto Scales. So in general, if you recognize some of the models that you saw today, or you recognize some of the names on your equipment, a good first step, even again, to just call and say, I see Detecto, I have a Detecto scale, and can you take it a level deeper for me, to understand if that's connectable or not.
One last question is, what do I have to do to get started?
Yeah, wonderful question. I have some information here that I will share with you. So to get started, please reach out to myself, Renae Buyeske at directsupply.com. Happy to answer any additional questions that you may have, put together some pricing or check on that connectable equipment for you. You are also welcome to reach out to your dedicated Direct Supply account manager. They are very familiar with DS Smart and can help get you started, answer some of those questions for you, and of course, loop me in and connect with me if they need some additional information.
Awesome. All right. Well, thank you for all of the great questions, everyone. And thank you, Renae, for your time. As Renae said, for any further questions, please contact her at the email address on the screen. Thank you.
Thank you so much for joining us.